Okay, so my phone's about to power off, but I'm gonna try to finish up the how to know if you have mitochondrial dysfunction or whatever the video was titled. I'm pretty sure in the last part, which was the part 3, I was going back over something that I honestly shouldn't have even brought back up because I mentioned it in the part 1 and part 2. But I remember my phone had cut off when I was going back over the whole pelvic floor thing, and I was mentioning when I tried carnivore for 3 days, and then when I tried it the second time for 7 days or almost 8, or at least I think that's what I was talking about. One thing I can add on to that I probably hopefully didn't say already is that apparently insulin resistance or diabetes can cause pelvic floor dysfunction because it weakens the pelvic floor muscles, especially in females. Then there's the fact that you have so much sugar / glucose in your blood and everywhere else to where you can get yeast infections, and that can cause some pelvic floor issues. And then what I also now know is proteinuria and high urine pH, which apparently usually doesn't have symptoms, but for me, I can tell more when my bladder is already inflamed due to other things. But knowing what I know now, and knowing that the symptoms that I have and have been had, but get worse when my bladder's more inflamed, is proteinuria and high urine pH, I can say that honestly, that is not a new issue. That's definitely something that I've had going on for years, but I just never knew that that's what it was. And I can also say that, what was I gonna say? Okay, so what I was gonna say is that, some ways to know if you have kidney problems in general and you're not just like having UTIs or something is one, if it's ongoing for a long time. And I remember back when I was like, I don't know, that was a couple years ago. I would say maybe I was like, not 14, maybe 15, when not really, I somewhat started trying to get to the bottom of what was actually going on. I was doing research and I found out about how people were saying that they use D-mannose and cranberry juice to prevent recurring UTIs or yeast infections, or just having the symptoms but not testing positive for UTI or yeast infection. But knowing what I know now, if you constantly have that going on, you have kidney issues and you also have insulin resistance. You shouldn't just keep letting some doctor tell you have a UTI or tell you don't. And honestly, for me, I don't really know if they were testing me for any of it or not, so I don't really know if I ever really didn't, at least back then. I don't know if I really didn't have a UTI or not because I would never end up getting tested for it, but like, either way, I know that my kidneys aren't working how they're supposed to, and obviously I've had insulin resistance or iatrogenic insulin resistance for like a couple years now, and honestly, knowing what I know now, I could even say that I had issues before the iatrogenic situation, but the iatrogenic injury just put the icing on the cake. Because, like, the more research I've done, the little tests I have done, I found out that a lot of stuff I have going on hasn't really been new issues. It's actually just old stuff that was ignored that got worse over time. But luckily, I still found out pretty early. I mean, a lot of people keep letting people gaslight them and tell them whatever in the world to their like in their 40s. So I can completely reverse all of it. So that's the good thing for me. But yeah, if you have to sit around taking D-mannose and drinking cranberry juice, and what was the other thing? Oh yeah, this one thing that I found could help sometimes. I really feel like it depends on what's actually causing the pelvic floor pain, but taking a binder like activated charcoal or cinnamon, specifically the cinnamon that came with the Purify kit. Although the Purify kit did not work at all for me, but the binder worked for other issues I had going on. But the Purify tincture did not. I didn't notice anything with that, to be truthfully honest. Not really. But yeah, you have to sit around taking binders and all that. You not only have insulin resistance and kidney issues, but you also have parasites and bacterial overgrowths too, which is why the binders and even a parasite cleanse would help with the pelvic floor dysfunction and other symptoms that go along with that. And another thing is that if you're doing the cleanse, some of your die-off symptoms can actually cause pelvic floor pain, and then you have to take a binder. And that's something else that I noticed back when I was still doing cleanses, specifically scram. I did notice a little bit when I was doing Purify, but not really. And Purify was honestly pretty small, and it didn't even last me anywhere near how long the jar said it lasts. Because I think Purify says it lasts 30 days, but it barely even lasts me like 15. Actually, no, I think it lasted 17. Maybe I was taking too much an accident, but I don't know. So yeah, that's to finish off that last part. And I've really just gotten confused with all this and where I'm actually at. I'm usually better at like keeping track of where I'm at. So I'm really hoping I don't go back over anything that I completely already said. I mentioned the spastic colon thing, the carnivore honey experiment. Okay, so maybe I didn't say this part. If your blood sugar, hold up. If your blood sugar drops every 2 seconds and you can't go 20 to 30 minutes without food, not just because of blood sugar issues, but just because of like cravings for stuff where you feel hungry all the time, but you really shouldn't be, that can be due to a couple of things with like, one, if you're still in a position where you're not digesting food, the mitochondrial dysfunction, so the fact that you're eating food but you're digesting it, or you're taking supplements to help you digest it, but the food still isn't getting where it needs to on a cellular level, that can make you still be hungry. And then I also have this thing where it's like I can't stop eating, but I don't necessarily feel hungry. And I very recently found out about this thing called leptin resistance. And I'm going to see if there's like tests for that. There may be on like Quest or LabCorp, possibly, maybe not. But I'm going to check. So there's that. That can be a sign you have blood sugar issues and the other issues I just mentioned. Also could be related to parasites too, and bacterial imbalances, which honestly, all these things go on at once. So if you have one thing, you have the other. Okay, wait a minute. Oh, okay. I know what this says now. Hold up. Okay. No and low carb diet or any diet may be tricky if you're not in the ideal situation for it, like eating whatever you're told. So like if you're in a situation where you have to eat whatever you're told to eat, lack of food options, lack of food in general, eating what's given out. So like if I don't know, you live at a shelter or something, you're just eating whatever's given out, which is actually really, really dangerous. Like when I was back on the East Coast for a little while, I was in NC, and like everybody in the shelter, the overnight shelter, whatever they were calling, oh yeah, the winter storm shelter, I think that's what it was called. Everybody in there had diabetes and hundreds of other issues, but yet, just due to what people eat more often in the South especially, all they gave out was cookies and bread and macaroni, a whole bunch of stuff that nobody there should have been eating. Pizza. And then they didn't give out jack at the men's shelter. They didn't even have mats or blankets there. That was like not it. And this was it wasn't a shelter, it was Catholic churches that had got some funding to to go towards I don't know what, but it was full meals at the women's shelter at least. But even though it was full meals, it was still was stuff that nobody in there was supposed to be eating, and everybody was getting more sick. And I had started researching bioweapons and genetically engineered weapons, especially in food when it comes to like eugenics, when I was around 8 to 10. And I can definitely attest to that now because I got used to eating the food on the West Coast, and it definitely made me a lot less sick. But when I was back on the East Coast, I was getting sick all over again, which I mentioned, I think I mentioned it, how like I was dropping down to 54 every single day just about after eating anything on the East Coast. All of it was making me super duper sick. So yeah, all this can cause a lot of issues. Example, which means you were given, wait a minute. Oh yeah, I remember what I was supposed to be talking about. The no and low carb diet part. So, an example that I could give, kind of like what I just said, you can't do low carb if you're staying at a shelter like I just mentioned, and the only thing they give out is macaroni and cake and what was other things? Just a lot of bread stuff, garlic bread, things like that. And yeah, you can't do that at a place like that or in a situation like that. So it's kind of like, well, no, I can't even say that. I was going to say you can eat and be in pain and get sicker, or you can not eat. But if you're in what I'm calling type 1 category, you really can't not eat, because even just 30 minutes or an hour or something without food and your blood sugar's dropping, especially if the last thing you ate was bread or something, which really the way that works supposedly is you eat something that's like high carb and then your blood sugar goes up and then it drops down. And I feel like I'm still confused about exactly what is considered bad when your blood sugar rises, because it's like I've never really seen mine be higher than it should be, but I still do have the crashes. But I guess it's not even about my blood sugar going higher than it should. It's just about the fact that it's going to rise and then fall in general. Because I've never like woken up and then checked my blood sugar and it was like 300. Because like I said before, I'm usually low. If it's not normal, it's low. So I guess maybe if you're in more like type 2 category, then you would have highs and all that, and it would be really bad. Okay, so example, which means you are given 10 things to eat and can eat maybe 0 out of 10 or 1 out of 10. So like in my I Can't Eat Pasta video, which was about this boy who went through something, I won't say similar, but he was in the Cash for Kids system. He got the ADHD label, and he agreed to take the neurotoxin psychotropic ADHD meth drugs because he thought that they would like help him out. So he agreed to take them. But then of course they gave him brain damage and screwed up his digestion and all those things. And so that video is just about some stuff he was saying about how the shelter always gave out pasta, but he can't eat pasta. And they literally would give out pasta every single day.